Welcome to Better Edge, a Northwestern Medicine podcast for physicians. I'm Melanie Cole, and I invite you to listen as we explore nutrition and weight management with Semaglutide. Joining me today is Dr. Robert Kushner. He's a professor of endocrinology and medical education at Northwestern Medicine. Dr. Kushner, welcome to the show. I'm so glad you could join us today. This is a very interesting topic. So can you start by telling us about your research published in the New England Journal of Medicine for anti-obesity medication?
Well, Melanie, first of all, thank you for having me. The study, which I had the honor of being the corresponding author, studied the efficacy, safety, and tolerability of a drug called Semaglutide, actually a drug that's already on the market for treatment of diabetes. This is a self-administered injection that's given weekly, used for diabetes, and people also can lose weight on this drug when it's taken at a lower dose at 1 milligram, and that's the approved dose for diabetes. What this study looked at is the effect of weight loss in individuals with obesity or who are overweight who did not have diabetes at a much higher dose of 2.4 milligrams. So in this study, which was a global study, about 2,000 individuals were randomized for 68 weeks to all of them receiving lifestyle counseling, and then either received the active drug, which was Semaglutide 2.4 milligrams self-administered weekly, or placebo, kind of a top-notch prospective study that we do. And the results were really incredibly impressive, enough so that it got published in New England Journal of Medicine. After 68 weeks, individuals randomized to the active drug lost on average 15% of their body weight versus 2.4% of those who took placebo alone. And just one more thing, Melanie, which really got it called a game changer in the public media. Not only is a 15% weight loss not seen before with drugs, but 1/3 of individuals on the active drug lost 20% or more of their body weight. That's almost starting to bridge the amount of weight loss that some people achieve with bariatric surgery.
Wow, that is amazing. So how is Semaglutide changing the approach for treating patients, and on average, how long do they need to be on it to reach that full effectiveness?
Semaglutide mimics a naturally occurring hormone in our body that's produced from our intestines. Fancy name is GLP-1. It's a naturally occurring hormone that causes us to be full, less hungry, more content between meals. So it kind of governs when we eat and when we stop eating. And that's a natural physiologic signal. So this hormone, which is synthesized as a drug, is then administered back to the body. Now, at lower doses, as I said before, it's used for diabetes, so it helps to increase your naturally occurring insulin so you can clear your blood of blood sugar and improve diabetes. But at the higher doses, it augments this appetite suppressing effect which occurs up in the brain. And the way individuals lose weight is that by reducing appetite, so you're less hungry, you're more full, you're more content between meals. You have less cravings for food, less thoughts of food. That's what appetite is. By having that in check, individuals who live with obesity are able to follow a calorie-controlled and a portion-reduced diet more consistently, and that's what leads to weight loss. Now, we think of obesity as a chronic relapsing disease. That may be a new concept for a lot of the listeners. Obesity is not self-will brought under your own control and should be shamed, or one does not have enough motivation to lose weight. That's not what it is. We think of it as a biologically based chronic disease. And that's why, by the way, we're even thinking about using medications. But you need to use the drug long term. And I use the comparison with my patients about diabetes. Right? If you had diabetes, you would be on a medication, would improve your diabetes, and you have to stay on that medication because if you stop it, the diabetes is likely to come back. Same with hypertension, by the way. So we think of obesity in that same vein, a chronic relapsing disease that if you respond to the medication, it needs to be taken long-term to control the condition.
So what is the FDA saying about it?
Well, it's approved this year. It was submitted at the beginning of 2021 and was approved in June of 2021. As the first new medication approved for obesity since 2014. So We call this a second-generation medication because it's hitting the amount of weight loss we have never seen before. That's number one. Number two, it's leading the way of thinking about obesity as a hormonally driven condition and thinking about hormonal treatment for obesity, just like we think of hormonal treatment for diabetes where we use insulin.
So for other providers, Dr. Kushner, and they're counseling their patients who are going to start to hear about this, can the benefits be sustained? What would you like to tell them about any long-term studies that we're looking forward to? What would you tell them about counseling their patients?
Well, I would tell them there's a number of studies that have already been published. They're called STEP trials for individuals who live with obesity or are overweight. And they've looked at a variety of different questions. What happens if you stop the medication? How does it work when you add intensive behavioral therapy? What is the 2-year response to the drug? And they've all come out very positive. But the one study I want to highlight is called SELECT. And it's a long-term cardiovascular outcome trial that has already completed enrollment. Results should be available in the next few years. And what we're looking at is, does the use of this medication actually improve hard cardiovascular endpoints? Those are things like heart attack, stroke, dying of heart disease. And we're anxiously awaiting the results of that trial. And what we're hoping, of course, is that not only does an individual lose weight and, of course, improve all of the markers along the way, like blood sugar improves, blood pressure improves, the blood fats improve, inflammatory markers improve. That's already been documented. What this study we hope to show is that it's also going to lead to improvement in cardiovascular endpoints. That will be an exciting outcome and should give a lot of providers and patients confidence that not only does drug help me lose weight, it actually improves my quality of life as well as outcomes that we're trying to avoid because of our weight.
Certainly true. Those cardiovascular effects will be huge for this. So tell us how you're incorporating these findings into your work at Northwestern Medicine. How will this impact weight management research and potentially other treatment options for patients in the future?
Well, Melanie, I run the Center for Lifestyle Medicine at Northwestern Central Region. It's a interdisciplinary group practice of medical providers, registered dietitians, health psychologists, and bariatric surgeons. So we've been using a comprehensive medical model to treat individuals for their obesity for quite a long period of time now. Adding this semaglutide 2.4 milligrams is one more treatment approach of what we already been using, which includes other medications that are already on the market. How it's going to inform us regarding treatment of obesity is it's leading the way towards hormonal treatment for obesity, and there's many other medications and hormonal analogs or agonists. These are drugs that mimic naturally occurring hormones that are already in the works. One has already been submitted to the FDA for approval, and others are working their way through the treatment cascade that eventually, hopefully, will lead to an FDA approval.
Can you leave us, Dr. Kushner, with one parting piece of information? This is such an exciting development, and I hope you'll come on and update us as we learn more and as you see more of your outcomes. But leave us with one parting piece of information for other providers listening and what you'd like them to know about the work and the research that you're doing on semaglutide at Northwestern Medicine.
The parting information I want to leave is the challenge that we face in getting primary care providers to embrace treatment of obesity at the primary care level and utilize medications when they're appropriate. The exciting work that I and others are doing to help individuals who live with obesity improve their weight and their medical problems will stay on the floor unless it's picked up and used by primary care providers. This is not a specialty drug. This drug needs to be embraced and used just like drugs we use for diabetes or hypertension.
What great information. Such exciting time to be in your field. Thank you so much, Dr. Kushner, for joining us today. And to refer your patient or for more information, please visit our website at nm.org to get connected with one of our providers. That wraps up this episode of Better Edge, a Northwestern Medicine podcast for physicians. For updates on the latest research, medical advancements, and breakthroughs, please follow us on your social channels. I'm Melanie Cole.